Okay, welcome everyone. Good afternoon and welcome to day 2 of the Norfolk County Fair. I would like to welcome all members and guests to the October 4th, 2023 Board of Health meeting and remind everyone that our meetings are web streamed and televised, so please make sure your phones are on silent. If you're attending virtually, please mute yourself when not speaking. Use your staff Teams raise hand feature icon to be called upon and remove it after you're finished speaking, and ensure that your camera is on and you have unmuted yourself. With that, I call the October 4th, 2023 Board of Health meeting to order. And I would like to confirm that all Board of Health members are in attendance today. And I'd also like to take the opportunity to officially welcome Sarah Page as General Manager of Health and Social Services. I understand you're on day 2 as well.
I align things with the fair. Thank you very much for having me.
It's a good benchmark. I'm looking for a motion to approve the agenda as presented. Moved by Board Member Michelli, seconded by Board Member Columbus. All in favor? Carried. Are there any disclosures of pecuniary interest today? Seeing none, we have no consent items, no early closed sessions, no deputations, and no presentations. So we can move along to item 8, which is approval or correction of any board meeting minutes. And before us today are the meeting minutes from September 6, 2023. Okay, seeing no hands, I'm looking for a mover and a seconder to approve the minutes as presented. Moved by Councillor Board Member Duthie, seconded by Board Member Van Passen. All in favor? Carried. Communications, items 9.1, 2, 3, and 4 are before you. Does any board member wish to pull any of those for discussion? Seeing no hands, and staff, are there any comments you want to provide, council? No. Okay, great. A motion to receive items 9.1 through to 9.4 as presented. Moved by Board Member Berry, seconded by Board Member Huffman. All in favor? Carried. And staff reports. Item 10.1 is up first with HSS 23057. And Syed, Director of Public Health, would you introduce the report on behalf of Dr. Locke?
Thank you. Through you, Madam Chair. So Dr. Locke is off, so I'll be presenting some of the features of this report. So there are two important things in this report. The first one is now the COVID vaccine. So we have new COVID vaccine available at the health unit now. And currently, as I'm speaking now, so a vaccination clinic is happening at Dunville office. So this vaccine is a new vaccine from Moderna, and that is for variant XBB 1.5. There are some particular eligibilities for us for high-risk populations for this vaccine. But now we have started rolling out these vaccines to the communities of Haldimand and Norfolk. The second point I want to touch base on is we participated in fall preparedness exercise for the upcoming winter respiratory season with Ontario Health. It was a tabletop exercise, and the objective of this exercise was that we'll be learning about mutual roles of our local system partners and identify gaps in preparedness. So that went really well. With this, I am happy to answer any of your questions. Thank you.
Thank you, Madam Chair, and through you. When do you anticipate the COVID clinic to come into Norfolk?
Thank you. Through you, Madam Chair. So we have a schedule that I have to look at our website, but hopefully this week we do have a clinic at our CAB office in Simcoe. That's correct.
Secretary receive as information. Board Member Columbus, by Board Member Pete. All in favor? Item 10.2 048.
Thank you. Through you, Madam Chair, I would like to introduce my team to present this report. Sarah Titmus, who is the Program Manager for COVID Response, Julie Richardson, Emergency Planner, and Nicole Stone, Health Planner. Thank you. Over to you.
Good afternoon. My name is Sarah Titmus, and as Syed mentioned, I am the Program Manager for COVID-19 response here at the Haldeman Norfolk Health Unit, and I have with me today my colleagues Julie Richardson and Nicole Stone. And this afternoon, we will be presenting to you report number HS 23048, After Action Report for information only. Next slide, please. So what is an after action report? Well, it is a process that is best practice after an emergency to review your operations during an emergency, in this case, COVID-19. The process is completed in order to document what actions took place, assess challenges and best practices, and make recommendations for improving future emergency responses. This project took place with the help of an internal committee and an external engagement agency. Our end goal was to identify improvements in emergency policies and procedures for the health unit. The time period for the project was January 2020 to June 2022, and I will now hand over to Julie and Nicole to provide highlights of the project today.
Thank you, Sarah. So yes, like Sarah just said, one of the purposes of conducting an after-action review is to document our response, again, from the time of January 2020 until June 2022, which is when COVID-19 response transitioned back to just our COVID-19 response team and our COVID-19 vaccine team. So in the summary report, there is an abridged timeline, and a more detailed timeline and narrative of the health unit's response were also documented through this process. So today we're just going to highlight a few points during that time for you. And the graph that's up in the screen and also in your package helps to depict the incredible amount of work that was accomplished during this time period. So March 2020, when the health unit had its first confirmed case of COVID-19, again until June 2022. So the green bars are the number of confirmed cases in the hundreds, and the yellow line is the number of confirmed outbreaks. And you can see the waves of cases throughout the pandemic and the outbreaks that follow in a similar pattern. So in early 2020, the case and outbreak numbers are relatively low compared to what we saw later in the pandemic. But early case and outbreak management for a novel disease included activities like setting up procedures for case and contact management, organizing testing, following up with any suspected cases and public communication. We also managed 2 very large outbreaks during this time before formal guidance from the province on best practices for outbreak management was released. Each successive wave saw more cases and more outbreaks, and the health unit continually adjusted its response based on the needs of the community, direction from the province, and implementing efficiencies to improve our response. You can see the peak of cases and outbreaks in December 2021 and January 2022 when the Omicron variant arrived. And as I'm sure you can appreciate or remember, these were incredibly busy times for the health unit. And then in March of 2022 is when the provincial government released its Living with and Managing COVID-19 plan, which signaled the move to recovery from the COVID-19 pandemic response. And then also on this graph, on top of the case and outbreak data, we have the blue line that shows the number of COVID-19 vaccine doses administered each month by the health unit and by our community partners. And that axis is on the far left in the thousands. So starting in December of 2020, there was a significant effort mobilized in order to coordinate and vaccinate those most at risk, followed by adults and the general public, and later on children and youth. And at the peak in June of 2021, the mass immunization clinic in Cayuga was vaccinating over 1,200 people a day, and over 40,000 doses were administered in that month. I'll also briefly highlight some of the quantitative statistics from our COVID-19 response. These are, again, just from the time period of January 2020 to June 2022. Our current COVID-19 statistics are available and still updated weekly on our health unit website. So this is for that period included in our review. So during that time, we had 8,863 confirmed cases of COVID-19 reported and managed by health unit staff, plus many more contacts and persons under investigation. And of those cases, there were 82 fatalities where COVID-19 was the reported cause of death. There were 272 confirmed outbreaks declared in settings such as hospitals, long-term care homes, retirement homes, congregate settings, schools, and rec settings. And this number does not include all of the suspect outbreaks that the health unit also supported. For this time period, over 221,000 COVID-19 vaccine doses were administered by the health unit and partners at 94 unique vaccine clinic locations, plus 31 locations where the GoVax bus offered clinics. And this high number of vaccine clinic locations speaks to the health unit's strategy to be adaptable as vaccine demand ebbed and flowed, and to try to reach as many people as possible in our communities. During this time, the health unit responded to more than 66,500 calls to support the public with booking vaccine appointments, enforcing COVID-19 measures, answering questions related to COVID-19 infections, and other inquiries that came into our few different COVID-19 hotlines. There were over 80 media briefings, which were held to keep the media and the public informed of the status of COVID-19 in our community. And all of this work was accomplished due to the dedicated and passionate teams at the health unit and Norfolk County staff who were redeployed to support our response. At the peak, there were over 150 staff that were part of this team. We also want to acknowledge that the health unit's response was strengthened by the support and leadership of many partners and stakeholders, both in the community and within Norfolk County. I'm now going to pass it off to Nicole to walk you through the methods and the final recommendations of this review.
Hey, thank you, Julie. So I'm going to share with you briefly the methods we took to generate this report. So the project, while voluntary, provided opportunities for all health unit team members to participate and provide feedback. Before any data collection occurred, we also received approval from Public Health Ontario's Ethics Review Board. For this project, a multi-phased and iterative data collection and interpretation process was used, with each phase informing the next. The first phase of data collection included a review of emergency documents. This document review was completed to help generate a response timeline, to identify emerging themes or pain points, and to inform the development of data collection tools like our survey and key informant interview guide. Following this, an online survey was sent to all health unit team members, as well as individuals who were redeployed to the response from other county departments. Key informant interviews were then completed by an external engagement agency with members of the health unit's leadership team. Finally, key themes generated from the survey and key informant interviews were explored through a facilitated workshop, which identified root causes as well as assessed and prioritized corrective actions or improvement ideas for future emergencies. And through this process, 5 key recommendations were proposed. So these are the 5 recommendations that I will go over now. Due to the unprecedented response to the pandemic, emergency plans, training, and tools were not able to sufficiently prepare the health unit to respond to a public health emergency of this magnitude and duration. Therefore, the first 2 recommendations are around training and review and update of emergency plans. The first recommendation is to develop and implement a comprehensive emergency preparedness training plan for the health unit, which includes specific and regular training requirements outlined in an emergency preparedness policy for all team members. The second recommendation calls for a review and update of all emergency and business continuity plans, which incorporate lessons learned from the COVID-19 response. These reviews will focus on ensuring that these plans are practical and easy to understand, while also providing sufficient detail to guide the health unit in future emergency responses. The third recommendation is around exploring opportunities to support staff redeployments, flexible hiring, and upstaffing when the health unit activates its emergency plan. A common challenge that we heard in the review was around heavy and persistent workload. An emergency response of this size requires individuals to transition to new and unfamiliar roles and may require the quick hiring of additional staff to support the health unit in balancing the competing pressures of emergency response and maintaining core public health programs and services. The fourth recommendation is around coordination. A Municipal Emergency Operations Center, or EOC, is a facility where key municipal personnel and other agencies gather to support the activities taking place at the site or sites of an emergency while facilitating a coordinated response. During COVID-19, municipal EOCs provided functions that were central to the health unit's response. Therefore, this recommendation calls for the health unit to continue to build strong partnerships with Haldimand and Norfolk counties and establish joint plans on how the health unit works together with municipal EOCs during public health emergencies. Finally, the last recommendation is around technology. The pandemic response forced the health unit, like many organizations, to alter and adapt standard operations, resulting in innovations that can be leveraged beyond the pandemic response. Investing in technology software that would enhance the health unit's ability to respond to future emergencies, but will also be valuable in program delivery and operations during non-emergency times, would strengthen the organization's preparedness and ability to maintain business continuity. In addition to these recommendations, 10 lessons learned are highlighted within the report. These range from ensuring policies, procedures, and resources are put in place early to prioritize responder safety and providing regular debrief opportunities, to providing strong risk communications and leveraging partnerships to support public health efforts during an emergency. Together, these recommendations and lessons learned have informed the development of an improvement action plan, which will guide staff in operationalizing these recommendations and ensuring that the health unit is better prepared for future public health emergencies. And that concludes our presentation. Thank you, and I will open it up for questions.
Thanks very much, staff. Are there questions from the Board of Health? Board Member Bandandrishi.
Thank you, Madam Chair, and through you. You're making these recommendations. So what are your thoughts? What are your next steps then? Can I ask that question?
Through you, Madam Chair, to the board. And that is a great question and something that we are working quite hard on right now. So as part of these recommendations, we're developing an improvement plan. And part of that plan lays out each of the recommendations and the lessons learned on what our actions are going to be able to move those forward. And so over the next year to 18 months, we're looking at actioning all of the items from the improvement plan that link quite solidly back to all of the recommendations. So lots of work to come. This may be the wrap up of this particular project to say, but we know that is the start of the next phase, which is to operationalize all of the recommendations.
Thank you. And how does this reflect with the province? Is this something, a report that you would also have to present to the province for the health units, or how does this move forward, all this information that you've gathered?
Well, through you, Madam Chair, to the board, again, an excellent question. At this point in time, there is no stipulation from the province and that these reports have to go back to the Ministry of Health. After action reports are considered a best practice, and I think at this point we're one of 7 health units who have undertaken an after action report, and reviewing some of those other after action reports, our findings and recommendations are very similar and much in line with what other health units have also found. And so we have undertaken a report with our staff as well, so that they are fully aware of what's going on, and we will be reaching out to the ministry to see if there is any further actions with this report that they would like to see from us.
And one more question, if I may. Do you anticipate the province actually going to put out some recommendations themselves? Because if they're gathering all this information and many of the health units have contributed to this, do you think at some point in time that they would gather something to be able to bring back to the different health units?
Through you, Madam Chair, to the board. Yes, I do anticipate that that's something that the ministry will do. They've already been reviewing the Ontario Public Health Standard for Emergency Preparedness. We've already undertaken some full preparedness planning. There was also some of recommendation that came out from the ministry. So I would expect there will be more coming as well.
Thank you very much.
Thank you.
Any other questions? Board Member Columbus.
Yes, thank you, Madam Chair. We're talking about our past experience here, but is there any indication from the province as to any funding for COVID in the year 2024?
Through you, Madam Chair, to the board, I'd like to refer that question to Mr. Shah, if possible.
Thank you. Through you, Madam Chair, as of today, we don't have any information about COVID-19 funding for 2024.
Questions from board members? Okay, I'm not seeing any hands. I wanted to just read this point and maybe give it a little bit of airtime. Page 6 of the document, the summary report. At the bottom, you'll notice there's a quote from a staff member that I guess chose to remain anonymous, but it says, "Walking into the first mass immunization clinic is something that will always live with me. It was an incredible example of how a community can come together and work towards a common goal to accomplish the impossible. It was the best display of teamwork, partnership, hard work, learning on the fly, etc., that I have ever witnessed in my public health career." So I think it's a good opportunity to just pause and think back about COVID. You know, much of it seems surreal, truly, when you think about the throes of what was happening and the Board of Health at the time and how our staff adapted and worked tirelessly. And I know that they took the role very, very seriously. And many, if not all of our staff members began committing themselves to the public service in a way they probably never had ever before. I know that countless members had significant hours, logged additional hours away from their friends and their family and their homes during COVID to support the community. And I think it's important to note that they were doing much of that without a roadmap or a significant plan on how they were supposed to react and protect our community. So I'd like to take the opportunity to thank all of our staff, all of the essential staff, especially the health unit staff, because you truly are some of our unsung heroes that don't get a lot of attention and a pat on the back, but you really did carry us through COVID-19, I would say. And your dedication and your sacrifice to the community certainly does not go unnoticed here at the Board of Health and for many, many other community members. So thank you for everything you've done. And if anyone else wants to speak to the staff with regards to their COVID-19 efforts, I would open the floor up. We covered it. There's lots of shaking heads in the room, staff. We appreciate it, everything that you do. Thank you. With that, we have a recommendation before us. Mover and a seconder to receive it as information. Board Member Michelli, seconded by Board Member Duffy. All in favor? That's carried. Thank you very much. Item 10.3. HSS 23050, HSS 23058. Syed?
Thank you. Through you, Madam Chair, I would like to request you to present both 10.3 and 10.4 together because 10.3 is an update to 10.4. Okay, thank you. So again, through you, Madam Chair, so currently Health Unit is conducting a strategic planning process in order to develop a 5-year strategic plan. As per Ontario Public Health Standards, boards of health must have a strategic plan to establish strategic priorities over 3 to 5 years. Our last strategic plan was for the period of 2016 to 2020. In spring of 2022, while we were moving towards the recovery phase of pandemic response, an interim strategic plan was developed with input from staff, which help us for the next 12 to 18 months. Currently, we have contracted an external agency to facilitate a strategic priority setting process. So members of Health and Social Services Advisory Committee and Board of Health will be invited to participate in the strategic planning process that will entail focus group discussions, one-on-one interviews, an online survey, and a strategic planning retreat. The plan is to present the final report to the Health and Social Services Advisory Committee in early 2025 for final approval and to Board of Health, and a proper launch in Q1 of 2024. Staff wants to recommend that to help facilitate that clerks of both counties, they work together and come up with a schedule for Health and Social Services Advisory and Board of Health for strategic plan consultation. With this, I'm happy to answer any of your questions. Thank you.
Thank you very much. Questions from board members? Board Member Vanden Rishi.
Thank you. Through you, Madam Chair, to you, Syed. We're writing up, or you're going to be creating a strategic plan for the next 5 years. How does that coincide with the mergers that could be possible?
Thank you. Through you, Madam Chair. This is a very good question. We thought about it. So this strategic plan will help us to know about our local priorities and needs. And even if Board of Health decided to merge with another health unit, so this strategic plan will really help us to sort out that merger, as well as that will take care of our local needs and priorities, even if we go for a merger. Thank you.
If I may, Madam Chair, and I appreciate that. I think that's something you should be looking at. If we're trying to create a strategic plan for the next 5 years, we need to do it in thoughts of if we go in a different direction and we're associated with a different health unit, that would merge together. And I think that's important. So I like your idea. So it's good. Thank you.
Okay. We have a recommendation on staff report HSS 23050, which is also 23058, which is 10.3 in the agenda, and that will encompass both of the motions. Mover and a seconder? Moved by Board Member Huffman, seconded by Board Member Vanden Rishi. All in favor? Carried. Thank you. 10.5 Health Equity Program HSS 23049.
Thank you. Through you, Madam Chair, I would like to introduce my team, Marciana Montodo, Program Manager, and our Chief Nursing Officer, and Jackie Dover, Public Health Nurse for Social Determinants of Health, to present this report. Thank you.
Thank you, Mr. Shah. Greetings, and through you, Madam Chair, to the board. My name is Jackie Dover, and I'm a public health nurse with the health unit. And I'm here today again with my program manager, Marcia Anamantodo. And I'll present Health Equity Program Memo HS 23049 to be received as information. So I want to start by saying that health inequities in rural areas are well documented. And the World Health Organization defined health as a state of complete mental, physical, and social well-being, and not merely the absence of disease and infirmity. And so we're talking about here health equity. It's really achieved when everyone can reach their full potential for health and well-being. So in August of this year, so August 2023, we refreshed our health equity program. And this memo highlights the program goals, the pillars, and key activities. And I want to really note that this is an ideal time to refresh the program, given the current interest in strengthening public health, this current interest across local, regional, and provincial levels. So over the next 12 months, over the next year, our health equity program will really focus on building the capacity of our public health workforce to advance health equity. So our aim is really to ensure that no one in Haldimand and Norfolk County is left behind, especially those members of our communities who are the most vulnerable to poor health outcomes. So you'll see in the memo that we've highlighted the priority areas of the health equity program. And these 3 program areas are organizational capacity building, community engagement, and interprofessional and intersectoral collaboration. And I will provide brief highlights of each of these priority areas. So organizational capacity building includes training and skill development for our public health workforce, our public health staff, to support the integration of health equity, this health equity lens, into all of our programs and services. Community engagement. With community engagement, we're working closely with community members and community partners to strengthen our community connections, so existing connections, and also strengthening new relationships and connections as well. And finally, around interprofessional and intersectoral collaboration, this again is a strengthening of our partnerships. Internally, really strengthening across teams, so across our public health teams and across roles and disciplines, but also externally, so working to strengthen relationships across sectors. For example, early child development, housing, to give 2 examples. And in conclusion, so over the next year, we'll continue building on existing activities. This is not new work, building on lessons learned, and we welcome your thoughts, your input, your questions along the way. Well, thank you. This concludes the update, and we invite any questions from the board. Thank you.
Thank you, Jackie. Are there questions from the board members to staff? Board Member Vandendriessche.
Thank you, Madam Chair, and through you. I read this and I understand where we want to go with it, but what concerns me is the fact that when we look at people's overall health, mental and physical, I see where one group can attain something through the organization and others can afford to pay for a certain, but there's a working group in the middle that sometimes is missing. How do we address that? Because we don't want to leave somebody fall through the cracks, if you know what I mean, because it's all well and good to say, this is how you get your health. You might be prescribed something, but if you can't afford to pay for it, you fall in the gap and you're missing something. So I'm wondering if there's something there that, what your thoughts are on that.
Thank you. Through you, Madam Chair, to board member. So with health equity strategy, this is not separate from our other public health work. So this is built in and infused to our existing work. So the real aim is to really leave no one behind. We'll have, we call a more targeted or focused approach for those with the most need, but really looking at ways of building something in for everyone. Right? So maybe a more targeted approach for those with the most needs, but not leaving anyone out. That's sort of how the program is being framed. And I would love to defer to my manager, Marcia-Anne Manthoto, if you have anything to add.
No, I have nothing to add to that as well. So thank you, Jackie.
Thank you.
Are there any other questions? Seeing no hands, we do have a recommendation to receive as information. Mover and seconder. Moved by Board Member Huffman, seconded by Board Member Columbus. All in favor? Carried. And the last staff report is item 10.6, Strengthening Public Health and Voluntary Merger, HSS 23056.
Thank you. Through you, Madam Chair, I'll be presenting this report. Recently, we received a communication from Chief Medical Officer of Health about strengthening public health strategy. So there are 3 components of this strengthening public health strategy. The first one is clarifying roles and responsibilities of the local health unit. So there is a plan to conduct routine sector-driven review of Ontario public health standards. That is first. The second one is voluntary merger. So province is encouraging health units to look for voluntary mergers. And the third one is province has established a sustainable fund to support that mergers. The plan is province is asking health units to come up with a plan and submit the final determination by 1st of March 2024, along with the submission of annual service plan. So at this point in time, staff is recommending Board of Health to hire a consultant to review the pros and cons of voluntary mergers by Haldimand and Norfolk Health Unit to have a facilitated and informed decision making. With this, I'm happy to answer any of your questions. Thank you.
Board Member Vandendriessche.
Thank you, Madam Chair, and through you. Do you not feel that so what you're asking for is to have that consultant to help write the report and the input will come in through the staff? Is what I'm reading? Or are we looking for a consultant to create the whole thing? Or because at the end of the day, do we not have sufficient staff to be able to work on this?
Thank you. Through you, Madam Chair. So we want to have a neutral lens to all of this process, and inputs will be sought out from Health and Social Services Advisory Committee, from Board of Health, as well as from staff during that process. Thank you.
Very much.
Any other board members? Board Member Brenton.
Thank you, Madam Chair. My question is, in the whole process, our advisory committee, will they be involved or, I guess I'm used to in the past seeing like a couple of council members involved in the process, but is our advisory committee going to be involved in detail?
Thank you. To you, Madam Chair. Yes, advisory committee will be involved through all of this process.
Thank you.
Other questions? Okay, there's a motion before us today. Moved by Board Member Michelle. Okay, seconded by Board Member Huffman. Any debate, discussion? I'll call the question. All in favor? Carried unanimously. Thank you. Okay, we have no bylaws today, no motions. Does any board member wish to introduce a notice of motion? No? Other business? Please, Board Member Van Passen.
Thank you, Madam Chair. I guess it might be a question for the clerk, but the Health and Social Services Advisory Committee, again, we lost quorum the other day. Had to reschedule it for the second half of the meeting. Is it possible to appoint like an alternate council member to sit on that board with the intent that if one of the three existing members cannot make that meeting, leave it to them to contact the alternate to make sure that we can carry on with the meeting and have the forum? Is that possible?
Through you, Mayor, through Chair. We can look at the terms of reference and see if that's possible to have an alternate named. At this point in time, the members are very specific. So would it be one of our council members, one of Haldeman council members?
Well, I think Haldeman might be having the same discussion because we've had occasion where it was, Norfolk that was a little bit lacking. And the other day, I think Haldeman was a little bit lacking. And when we're both lacking, we don't have a meeting or can't finish it, right? So if it's possible that we could do that specifically name one other council member, but then, we leave it to whoever can't make it to contact that one to make sure they're going to make it.
Chair, is that something that I could just double check the terms of reference and bring that up at committee and council and committee?
Thank you.
Okay. Just confirming no closed session today as well. So with that, I'm looking for a motion to approve the confirming bylaw for today's meeting, being bylaw 2023-09BH. Moved by Board Member Brunton, seconded by Board Member Michelle. All in favor? Carried. And Board Member Huffman moves a motion to adjourn at 1:37 p.m. seconded by Board Member Barry. All in favor? All in favor? That is carried. Thank you very much. And we're back with public hearings this afternoon. Don't go too far.